Person-centred care is really about having the person themselves the centre of their healthcare.
Using a team of people who are coming on a journey with the patient to improve their health.
Person-centred care is about right care, right time, right place, because in healthcare we don't have time to waste and people really count.
This practice is a regular general practice and sees regular general practice things. What makes it different from other general practices is that we have a large number of people who have complex chronic care needs, as well as a large multicultural community that often don't speak English.
That means that, like all of us, they have a body that still needs care. It might mean that their health literacy and their ability to understand what we want them to do to stay healthy is a little restricted, so we need to take more time, which in a world where time is money is a bit challenging.
We recognised that we needed to change something. So that's when we really started that journey around trying to create a more person-centred model. There is good evidence and data that we get better outcomes for patients with a person-centred care model. The Brisbane South PHN also started to talk more about this model of care, and so over time we've collaborated with them on various projects.
So they are a conduit for us for improvement, and certainly in the case of person-centred care they've got resources that we can draw upon in terms of training our team, in terms of learning what others are doing that we value.
The nurses are often able to attend the education sessions that they put on, and they also send out a lot of information in their e-blasts, updates, things like that, which is great.
Part of our team-based care environment here is that we like all of us, the whole medical team, to be working together and pulling in the same direction. And when we use data, it's a much more powerful tool then to be able to convince the members of the group that we need to make more effort here.
So for us, one of the things that's a bit different is whenever a new patient comes to our practice, they always get to see a nurse first, because we know that the nurses will take the time to collect all of that family history, social history, allergy history, smoking. And so we start with good data around every patient, and then it's a case of enriching it from there.
There is a very personalised interaction between doctor and patient or person who's coming in to see them. But the problem with that is that then we don't always see what's happening across a practice, and it can be difficult to have a real sense of where quality lies. The use of data is definitely one of the linchpins really in the whole situation of improving quality.
Nearly 1 in 5 of our consultations, for example, is delivered in another language or with an interpreter. And we're trying to give our patients consistency of care with the same doctor, the same nurse, the same allied health practitioners.
It's great to see the same patients because you remember what they've done, you know where they're going, and so yeah, that continuity of care is great.
Every mother and every child is getting everything that is in the schedule plus more, so that we're identifying earlier kids who might be at risk and trying to wrap around that family health and social care programs so that they get the best start in life that they can. Data helped us do that.
This person-centred care model, I think, is great for the patients. I feel like they would make improvements. They would feel like they're part of the team. I think it's much more satisfying for the staff that are working in there, rather than you just quickly seeing a patient, they're in and out.
General practice can often be a fairly sad and isolated world where you're just working behind a door seeing patient after patient after patient, whereas the data brings to you a different sense of who those patients are and what you can do. So it's really quite empowering, and it reminds you why you got into healthcare in the first place, and it's about offering good care to good people.